Hi, good morning, everyone. So as John just said, we're having a few technical difficulties with one of our panelists, but I think we're going to begin and then just expect maybe some brief interruption in the background at some point in the next few minutes. But just bear with us on that. So to start off, thank you all so much for joining this webinar this morning. This webinar is the Global Response for Refugees and IDPs in the Time of COVID-19, focusing on our humanitarian programs in Colombia. And as many of you know, I think probably as most of you know, MedGlobal is an international health and humanitarian organization working to serve communities across the world by providing sustainable, innovative, and free health services to refugees, displaced people, and vulnerable populations in crisis-affected areas. And we ultimately aim to create a world without healthcare disparity. So in the midst of the deadly global COVID-19 pandemic that we're experiencing, we, in coordination with our on-the-ground partners, are responding with urgency. And we're hosting this 5-week or 5 to 7 week webinar series focused on our humanitarian programs, as well as our global health response for refugees, IDPs, and vulnerable communities in Colombia, Syria, Gaza, Yemen, Bangladesh, Lebanon, and Pakistan. And I think, as most of you know, there are right now over 70 million forcibly displaced persons in the world, and we know that they will be the ones who are hit the hardest by the COVID-19 pandemic. These communities must not be forgotten now during this pandemic, and they must not be forgotten in general in the future moving forward. So for this webinar, we're focusing on the health and humanitarian response, primarily with displaced Venezuelans in Colombia. And we have really incredible panelists, physicians, and practitioners who have been doing amazing work in Colombia over the last several years on this panel. And so this discussion will include a focus on our primary care clinic, the MedGlobal COVID-19 response plan, the experience of volunteering for MedGlobal in clinics, the use of point-of-care ultrasounds in the field, and opportunities for cross-border work and support. And so with that, I'll turn it over to Lindsay Dubois, who is our Colombia field coordinator.
Hi, everyone. Good morning. Can you hear me okay, Kat? Okay, great.
Yep, you're good.
So like Kat said, my name is Lindsay Dubois. I'm the field coordinator here in Colombia. Our goals for this webinar are to present an overview of our work in Colombia over the last year, and also to highlight our response to COVID-19 in this particular setting. This will be including both our work with our ongoing clinical operation and also our response during the medical brigade that took place just about 2 weeks ago in Cucuta, and that was just before Colombia closed its borders. So we'd like to use this time as an opportunity to discuss the larger challenges we face when meeting the needs of the most vulnerable populations in the midst of this global pandemic. Like Kat said, I'll start off with just a brief overview of our work in Colombia. Obviously, we've had to implement many specific changes over the last few weeks, so I'll let our panelists talk about those specific changes to our ongoing operation and also during the medical brigade. Dr. John Kahler will be speaking to us. He's one of the co-founders of MedGlobal and the director of MedGlobal's Colombia program. He will provide us with an overview of the medical brigade that we completed in Cucuta, and will also discuss the unique challenges of working in this context and responding to the infection control guidelines that we're changing day by day. Dr. Peter Houck is a physician and an epidemiologist, and he was also instrumental in establishing our program in Colombia. Dr. Houck will speak in detail about the infection control changes that we've made to our outpatient clinic. And then Dr. Riley Jones is here. He's a physician and director of the Global Health Program at the University of Florida. He was recently a volunteer with MedGlobal in Colombia in our outpatient clinic, and also helped to lead the group of volunteers that we had working during the medical brigade. Dr. Argenis Mena will be joining shortly. He's a physician and the CEO of the Dr. Luke Foundation. So we partnered with Dr. Mena and his team of Venezuelan doctors during the medical brigade, and he'll also be chatting with us about some cross-border work that he continues to do in Venezuela. So just a reminder before we get started, you will be able to post questions into the chat box, and we will get to those at the end of hearing from our speakers. And I believe this webinar is being recorded and it will be available on our website. Let's see, I'm just going to present. Okay, great. So to give you an overview of the situation in Venezuela and Colombia, as most of you already are likely to know, the situation we're facing in Colombia is a result of 4.5 million Venezuelans who have left their country as a result of political turmoil and socioeconomic instability, including high rates of inflation. So many Venezuelans have been forced to flee their home due to lack of food, access to healthcare, and many other essential services. So this is considered to be the largest exodus in the history of Latin America. The majority of refugees are families with children, pregnant women, and elderly people as well. Venezuelan refugees and migrants have fled to many neighboring countries throughout South America and Central America. Colombia hosts the largest percentage of Venezuelans and currently has about 1.4 million Venezuelans. And I'd just like to give you an overview of MedGlobal's work in Colombia over the last year. The majority of Venezuelans who arrive into Colombia enter through the border state of Norte de Santander, and the capital city of that state is Cucuta. So Cucuta is a major city and has become kind of an epicenter of migration. There are 3 international bridges where thousands of migrants cross on a daily basis. At this time, there are no official refugee camps in Colombia, so Venezuelan migrants and refugees live mostly in cities or settlements located on the outskirts of cities. So MedGlobal decided to respond to this growing need and began its ongoing sustainable operation in April of 2019. So right now, we provide ongoing support for an outpatient clinic in Cucuta. The clinic is staffed by a mix of local medical professionals and international volunteers, of course, and that was until recently. We provide routine primary care to children, adults, and pregnant women. We also offer nutrition services, dental care, lab services, and medication. And we have partnerships with many local NGOs in Cucuta. In 2019, we served approximately 17,000 patients, and that included 800 prenatal patients. In February of 2020, so just recently, we opened a first contact clinic at the Francisco de Paula International Bridge. So we were open for just about a month before the borders were closed in March. And that's certainly one of the biggest changes that our program has sustained. MedGlobal also participates in the UN cluster system. So this is the coordinating body for humanitarian organizations. And we also work closely with local and regional health departments. So with that, I'd like to turn this over to Dr. John Kahler. He'll be discussing our work during the recent medical brigade in Cucuta. Dr. Kahler, like I said, is a board-certified general pediatrician with extensive clinical and academic experience in Chicago, Illinois. Dr. Kahler has spent the last 25 years working with underserved populations in Africa, Latin America, and the Middle East. Since 2013, he's worked primarily with refugees, including the Syrian diaspora in Jordan, Lebanon, Turkey, and Greece. And in 2017, Dr. Kahler retired from his clinical practice and co-founded the international medical NGO MedGlobal. Last year, Dr. Kahler was instrumental in establishing our program serving Venezuelan refugees in Colombia.
Thank you so much, Lindsay. I really appreciate it. And I appreciate your presentation. I want to take a couple of seconds, please, to, as one of the MedGlobal co-founders and one of the executives, I want to take a moment to thank our generous funder, the Humanitarian Foundation of the Mormon Church, for sponsoring our project in Venezuela. They've been a remarkable source of support for us. In addition to that, I want to thank the the executives at the Medcare SAS, who are our sponsors in country. And I want to thank, of course, the participation and cooperation of the Department of Health, the Instituto Departamental de Salud, led by Dr. Carlos Martinez and administered by Senora Mena Varayama. They've been remarkable partners, and I can't thank them enough. When we planned on coming, as we came to Norte Santander, our goals were threefold. First, of course, to build a sustainable project. MedGlobal, one of the foundations of MedGlobal is its sustainability. And to do that, we developed, along with MedCare, a primary care clinic in one of the barrios that house a significant number of refugees and migrants, and the name of that barrios is Comuneros, and that's the picture on the screen right now. Along with that, we partnered with the AIDS Health Foundation, Action Against Hunger. So we built our first program to be sustainable with or without volunteers. The second level of that, of course, is that MedGlobal is a volunteer-heavy organization, and we wanted to build programs that permitted volunteers to come. We wanted the program to exist without them, but we wanted to build a good program for them to come. To that end, then we have the ability to use volunteers at both the primary care clinic and the first contact clinic at the bridge, and Dr. Jones will speak a little bit to that effect. But secondly, we wanted to build a volunteer heavy rotation, and to do that, this is what the Brigada Medica was to be. In December of 19, we partnered with the Cruz Roja Colombia in order to develop a quarterly rotation in which there would be what for our purposes is a gigantic health fair in Bogota, seeing 3,000 clients during a 2-day visit. And in addition to that, we tied movement into one of the barrios, El Talento. Could you, Lindsay, would you please advance the slide, the El Talento picture, please? We moved into El Talento, which is a barrio of Cúcuta. Lindsay, would you please advance the slide so that you've got a picture of El Talento on it. And we were going to have, there's El Talento on the left upper hand part of the screen, and you can see it's a relatively remote barrio. It's very hilly. You can't see too much of the hills there, and we joked that the only thing that would stop us on this brigada would be rain, which, by the way, did come. So anyway, we moved into El Talento. There were to be 20 volunteers for 3 days. And just as we were beginning the progress, COVID-19 came to Colombia. Appropriately, Cruz Roja, at the urging of the Bogota public health folks, stopped their participation in Brigada for this time. What we did at that time then, since we had many volunteers coming, we extended our stay in El Talento to 5 days, and saw close to 1,400 patients during those 5 days. Each day, the restrictions got more and more, with the local public health folks saying that we couldn't have more than 50 people at one time, then no more than 50 people total. So it got more and more and more. And we had anticipated seeing close to 3,000 patients, ended up seeing 1,400, and got rained out one day. So it was a success because we both got to meet the community leaders and set up our primary program. Plus, we were able to set up an ongoing support of an organization that Dr. Argenis Mena will talk about, is Dr. Houck Foundation, which will permit us to keep continuity in El Talento. So right now, our work in Colombia is supporting the local foundations with regards to their COVID response. We developed a COVID response for our clinic, and that was done very, very admirably by Dr. Houck will talk about it in a second. The third part of our ongoing program has always been looking to cross-border support. Because of the nature of the crisis, obviously we're not permitted to go into Venezuela to work. We support a very active feeding program in Caracas. And with our partnership with Dr. Mena, we look forward to when any version of the border is open. We look forward to expanding our services cross-border. So in Cucuta, expanding beyond Cucuta, and cross-border are the three things that our program has striven to do. I think we've done most admirably. Obviously, the world is very different now than it was a month ago. And the executives, both of our organization, thank you to Dr. Hannah Ibrahim and Dr. Zahir Salou for helping us patch together our next steps. And my colleague, Dr. Houck, myself, and Lindsay, along with Denise Pareja, will be trying to move forward with plans on the ground. So that's all I have to say for right now. Lindsay, if you want to move it along.
Okay, great. All right. So now I'd like to introduce Dr. Peter Houck, who will be discussing MedGlobal's response to COVID in our primary care outpatient clinic. Dr. Houck is a physician in Seattle, Washington, with training in family and preventive medicine, public health, and epidemiology. 10 years of his career with the United States Public Health Service were with the Center for Disease Control and Prevention, working in the fields of migration, quarantine, and pandemic planning. He's worked with MedGlobal in Greece and Colombia. And I'd also like to state that Dr. Houck was also instrumental in establishing our program in Colombia.
That's not Dr. Houck, but he's better looking.
There you are.
Can we cue up Peter, please, and let him get going, please?
Yeah, Peter, go ahead and take it away. Do you all hear my intro?
That's fine. Am I on? Can you hear me and see me?
You are on. I can hear you and see you.
Okay, excellent. Good morning, everyone. This is Peter Houck in Seattle. As everyone has said already, the COVID-19 situation really affected our work in Colombia a few weeks ago. Just to give you sort of the sequence of what was happening. Before we actually went to Colombia, of course, what was then becoming a pandemic was raging throughout Asia and had just arrived in the United States. So even before we left for Colombia, I left on the 9th of March, we'd put together a proposal to respond at our clinics in Cucuta that included the usual social distancing thing, trying to maintain physical separation between patients and between patients and staff. We tried to reduce the number of patients. We took into account in that proposal the probability that this disease was spread not only by the large respiratory droplets you might have heard about, but also by contact with surfaces and by spread through the air, which at that point was not the officially recognized, was not an officially recognized mode of spread. We paid attention in the proposal to patient education, as well as intensified cleaning of the facility, disinfection of surfaces, and so on, to take into account that virus is spewed onto tables, chairs, desks, and so on when people cough and sneeze. Now, as I left Seattle on the 9th of March, there had only been one case in Colombia confirmed at that point. When I arrived, the Colombians were actually doing what I thought was quite an amazing job. They were doing a temperature screening at the airport as you came through. They administered a questionnaire asking where we had been, what symptoms we had, how old we were, and so on. Then as we got into Colombia, it's already been mentioned that the government began to put restrictions on the size of gatherings. And that initially caused the cancellation of our clinical work in Bogota. They later tightened those restrictions, which caused us to adjust our operations in the Brigada at El Talento to have fewer people sitting around. We tried to maintain, we tried to do triage for respiratory illness as soon as a patient showed up at one of the clinical sites, and then isolate those people in a different part of the site there so that they wouldn't be in close contact with other people. We had gallons and gallons of alcohol-based hand sanitizing solution. We had masks, all sorts of things. My hands were almost never as clean as they had been at that point. So we were quite aggressive then. As time went on, though, things got a little bit hairier. Of course, as was mentioned, the border was closed, which led us to shut down our newly opened clinic at the Santander Bridge. And then things started to get even a little bit hairier in that there were restrictions on movement placed on the population. A curfew was placed. Things were shut down increasingly. And finally, towards the end of our stay there, you were not allowed to go anywhere, anytime. We were, because we had an exemption as medical people. At the same time, airlines were beginning to pull out of Colombia, and my return ticket home on the 21st vanished, and we were also having a difficult time finding ways to get out of Cucuta to Bogota. So we had a number of things on our mind then. Colombia eventually shut down all international travel in and out of Bogota on the 22nd of March. And as we left, things were getting rather interesting. So that was the response. We basically did everything to address what was known about how this virus transmitted through large respiratory droplets and contact from surface to hand to eyes, mouth, and nose and so forth, but also take into account the possibility of spread via an airborne, or what some people call aerosolization route. Now, since then, Medcare, our partner in Cucuta, has put a very complete set of control measures in place at our main clinic, and now our only clinic in Colombia. And so things, I think, are going about as well as can be expected. Colombia has done, I think, a very good job. It has been very aggressive and very timely in putting all these restrictions in place. It's going to be very interesting to see if they are more successful than many other countries, including the United States, in controlling this pandemic. Some new things have just come up. For instance, yesterday, the World Health Organization Situation Report has a one-page piece on how this affects refugees and migrants. It doesn't have a whole lot of substance to it, but it does stress the importance of this for this population. Another thing that came out actually just this morning was the National Academy of Sciences a committee came out stating that airborne spread is an issue. This is going to make everyone's pandemic response procedures a little bit more complicated. Will probably lead to recommendations to use face masks essentially everywhere, like when you're outside near people. Let's see what else is new has come out. Some new mortality estimates have come out that are a little bit better. And just to have a little bit of good news, here in Seattle, where restrictions on movement were put in place 3 weeks ago, where schools were closed on about the 11th of March, businesses closed thereafter, and the restrictions on movement have been tightened down a bit. As of day before yesterday, there was evidence that the number of hospitalizations for COVID was declining, about a 20% decline from the previous week. So there's some good news. There's also some evidence from California to the same effect, and the experience in New Rochelle, New York, where they really were very stringent on restrictions, was encouraging. So I think there's a little bit of good news. There's still a lot of bad news, And for our work in Colombia, it's really made things difficult since we can't go there anymore until the airlines start to fly again.
Peter, could you mention real quickly, please, a couple of the limitations that we had in the Comuneros clinic that we had to deal with vis-a-vis separation and things like that?
Well, the clinic is normally very busy, and the waiting room is packed with people. The exam rooms are relatively small, and it's an older building, so the ventilation is relatively poor. So the first thing we tried to do was get it so that we did triage of all patients outside on the sidewalk to try to separate people with respiratory illness from everyone else, and also hope to do all the examination and treatment of respiratory patients outside. There's a separate space upstairs that has a separate entrance where we were considering putting people with respiratory illness, but the problem is the ventilation system is not good up there. And if you have airborne spread, once you have one person with the infection coughing up there, the air is basically suspect for at least 3 hours probably. So under a lot of limitations, some of them imposed by just the physical structure, but also by how the disease is spread.
Thanks, Peter.
Okay, great. Thanks very much.
Great, thank you, Peter. Now I'd like to introduce Dr. Riley Jones, who will be sharing his experience as a volunteer in Colombia, including his experience working at the First Contact clinic that we had at the International Bridge, which was, like I said, open for just a few weeks before the Venezuelan border was closed. And he'll also share about his experience working during the brigade. Dr. Riley Jones is an early career humanitarian scientist and a community program in February. He earned his MD from the University of Louisville and holds 2 master's degrees in conflict, security, and development studies in global health from King's College of London, as well as biostatistics and clinical research methods from Tulane University. Currently an academic hospitalist at the University of Florida, where he directs the global health track for the internal medicine residency program. He has a personal interest in the role of medical education as a means to rebuild societies after war, and teaches remotely in the Horn of Africa in this regard. With his wife, Rachel, who served as our patient educator during the brigade, and their 3-year-old daughter, Riley recently returned after 2 months in Colombia on one of the last departing flights before the borders were closed. He'll be presenting a synopsis of the volunteer experience for the Colombia program. Thanks so much, Dr. Riley.
Okay. Thank you and welcome, everyone. So I've just returned from Colombia, where I was working in the Comuneros clinic, and am back to the University of Florida, where we are neck deep in our corona cases. Briefly, the Comuneros clinic, there were pictures early on, was actually a pretty well-run clinic. As far as, global health goes, we were somewhat limited on our labs at times, somewhat limited on our medicine availability at times, but overall it was a very easy clinic to work in with a lot of very knowledgeable local staff, nurses, Colombian doctors. As far as the cases of things that we were seeing, very commonly they were just long-standing, untreated chronic disease of a non-communicable sort, untreated blood pressure, diabetes, heart failure, these sorts of things. There were a fair number of infectious illness, so of course pneumonia, a lot of diarrheas, things of that nature. And then, and also of interest to me as a tropical medicine doctor, there were a few cases of suspected malaria. There were some other cases where we had a few patients with tuberculosis and a possible measles case. I don't know that we ever were able to follow up on that. But apart from that, by far, the 2 most common things that we were seeing were a lot of prenatal visits that had infectious complications with them. There is, we don't have official data yet, but there's a relatively high rate of syphilis complicating pregnancies, with some estimates upwards of 30% of pregnancies. And then some of the other more common cases that we would see were a lot of malnutrition, a fair amount in adults, but a lot of malnutrition in young children. So working in the Common Air's clinic, one of the challenges was figuring out how to get people going down the right aid pathways. There are programs that are available for pregnant women, children under the age of 5 years old. And then after that, there's not a lot of infrastructure that's available to children over the age of 5 and upward, unless they have a complication with like HIV or something like that. So a large part of my time is spent educating parents on how to make appropriate calorie trades. Very commonly, we would see things where family members were buying as many calories as they could, but they were nutritionally devoid calories. And so we did education on how to find complete proteins and how to balance the best that we could in a tough situation. And this is in the setting of there are several comedor soup kitchen type things where they actually serve a pretty decent meal, and I think they're serving something like 4,000 meals a day at several different locations around the area. So as coronavirus was starting to come into the area, things got to be a little bit more tenuous. I happened to be at the Paula Santander Bridge on the first day that the Colombian government was sort of flexing its muscles in the area, and they brought out trucks with loudspeakers and several people with clipboards and face masks, and were making loudspeaker announcements about the coronavirus, asking if you had symptoms. This actually caused a little, I wouldn't say a panic or anything, but people definitely started hurrying across the border. There was a lot of concern as far as what people are using the border for. So it's a little expensive for people to get into Colombia and stay in Colombia. So oftentimes they're going into Colombia, working, buying food, and then going back to their homes in Venezuela or sending food to family members. Now, as the border was beginning to close, this was worrisome for us because seeing a lot of these families that are coming there to get their food, and I'm seeing their children and their BMI is 10, and they're below 3% on their growth curves. This was concerning because the border was shutting down, and that's forcing people to have to go through illegal border crossings. Now, these are in areas where the control of these areas is a little bit tenuous between the Colombian government and some of the guerrilla groups that work in the area, most notably the ELN. So during my time there early on, the ELN, they did what they call an armed strike, where they wanted to prevent everybody from coming across the border, just sort of a show of force. They set a few bombs around the city, but they were in very conspicuous but low trafficked areas. There's even we saw the news reports. It was like in this just random box, and you see this Colombian security guy. He's just like picking it up and sort of shaking it about. And they of course were reporting everything in kilograms of explosives, when really it was just a gas can filled with gasoline. I'm sure that there were some other things, but that's all that was being reported at the time. It was interesting working in the area. The city of Cucuta is very safe, and taking my wife and daughter there, we felt perfectly safe, safer than in most other South American cities in which we've stayed. even during the armed strike with the ELN. So a video went out where they were saying that nobody's supposed to be outside, nobody's crossing the border, but they also had the caveat that if you were crossing for medical reasons, they were going to let you through, which I thought was pretty respectable as far as a listed terror organization goes. It's been interesting coming back across, talking about the ELN. It's been interesting to see the way that the coronavirus was starting to change things. So towards the end of my time, I started to see, and this is as coronavirus is starting to come into Colombia. This is as the borders are starting to shut down. I actually started to get patients that were coming from the Venezuelan side of the guerrilla movements. And we didn't press them too hard for details, but you definitely got the sense that that there was an awareness that the situation was changing, and they needed to look for alternative means to secure their health and safety. So we had members, we presumed, of the colectivos groups, which are basically the ELN on the Venezuelan side, that were starting to come through our clinic and looking for help. So after leaving in the situation of coronavirus, I just saw that the ELN released a statement for a unilateral ceasefire and are opening themselves up to talks with Bogota, citing humanitarian reasons. So it's been interesting to see some of the silver linings with the coronavirus. Okay.
Riley, I know you have to leave to get back into your neck-deep COVID response there. Could you talk just a little bit about the use of focus out in on the Brigada?
Sure. So we had we had access to an ultrasound while we were in the Brigada in the city, or I guess the community of El Talento. And it was a game changer, is what I would say. There are a lot of cases where you've got obstetric ultrasounds that you need to do, or gynecologic ultrasounds, pulmonary ultrasounds. And for cases where things aren't exactly clear, you put a probe on them and you've got your answer. And that was nice. The best part was the particular device that we were using is very low battery usage, and it when I first started out using ultrasound in tropical medicine situations, it was that situation where you have somebody running the Land Cruiser and you've got 5 or 6 batteries lined up to the Jeep, and we're constantly trying to charge an ultrasound or a tablet computer. The device that we used was very easy to use, very clear, and we also didn't run into battery issues. It was incredibly useful to have. We only had one in terms of the entire Brigada, and so we had situations where we had patients on the other side of El Talento that were being sent to us down in our area.
Thank you so much, Rod. I really appreciate the help, and please stay safe in Florida now that they've actually come into this world. So thank you so much. Really appreciate it.
Thank you, Riley, for that overview and for sharing those experiences. Finally, I'd like to introduce Dr. Argenis Mena, who will be discussing his work with the Dr. Luke Foundation in addition to opportunities for cross-border medical work. Dr. Mena led the team of Venezuelan doctors that worked with us during the medical brigade in Cucuta. Dr. Mena is a physician and CEO of the Dr. Luke Foundation. He holds a BA in theology and a medical degree from the University de las Ciencias de Salud. He has worked as a missionary doctor in Venezuela, Mexico, Costa Rica, Cuba, and the Amazon for nearly 30 years. Thank you so much, Dr. Mena.
Hey, good morning, everyone. Well, yes, I'd like to share a little bit about Dr. Luke Foundation. Like I once said in another meeting with other organizations, it doesn't matter how many organizations come and established here at the border here in Cucuta. The work is just way too much, like for as many organizations can actually come. So we are just one little drop for this major job. Anyway, but we do focus on the health, nutrition, clothing, and gospel. And by gospel, I mean when you lose everything and you just run out of a country as refugees, and someone who you've never seen them comes and tells you it's gonna be okay. Now that's a good news, especially when you lost everything. Anyway, I'd like to concentrate on health because this is mainly the meeting we're talking about. And before I start speaking about the other programs and things we're doing, I'd like to bring up a new situation that just happened, started it almost 6 days ago. For the past 5 to 6 days ago, here in the area started a foggy. It started, I mean, you guys, I mean, Lindsay, Peter, John, you guys know Cucuta. It's hot, windy, and dusty. That's how it is. But right now it's very foggy. And everybody started wondering what's going on. And so they started blaming on Venezuela or somewhere else who's burning. But that situation has not been found who is burning what. It smells like smoke. It's totally foggy. And but it's not only Cucuta, it's other areas, I mean, kilometers and kilometers away, not only in Colombia, but also in Venezuela. It's actually getting to Caracas, Venezuela. And we are 12 hours away from Caracas. So it's not good news. Why? Because we're trying to stay in quarantine, and then we got all these elderlies, I mean, having this crisis, not being able to breathe. Now they're being taken to the main hospital here in Cucuta. That's where you find coronavirus, and then they get somehow treated by the smoke situation, go back home, and now you don't know whether they got infected or not. This is a new situation going on. There are no answers. I mean, I've been on the checking on the news, and they have not found what is it that is producing so much smoke, but at the same time, it's way too much. I mean, like in terms of extensions, okay? I mean, like getting all the way to Caracas, that's like extremely way too far. Anyway, having said that, we do focus on health, and one of them is we have a small clinic right at the border. As soon as you cross Simon Bolivar's bridge, about 400 meters, we have a small clinic that we started about 5 weeks ago, a little bit more maybe, and it's meant to assist what we call Venezuelan refugees, pregnant ladies, and as you guys know, the situation in the main hospital here in Cucuta is that we got many ladies who are pregnant. They just show up there with no records, no nothing, and here's a doctor. Okay, I gotta take care of this lady and the baby, but I have no point of reference. They have no clue. They have nothing. Okay, that's a well-known situation. Many reasons for it. Why ladies do that, and Venezuelan ladies, is because once they want their child to be a Colombian child, but also because of resources and a better health system than they can find in Venezuela. And I can testify that I still work at a main hospital as soon as we cross the bridge, and from Cucuta to San Antonio, Venezuela in that case, and I know how it is, okay? Anyway, and so that was the reason why we opened that small clinic right across as soon as we cross the bridge. And we've been working on it. It's been good. I mean, we've been taking care of quite a few pregnant ladies. And the whole idea is to make sure by the time they're ready for childbirth, we have a good record system in order for them to do the follow-up is set, and this would avoid the chances of death, not only moms but babies too. Anyway, so I think it's a great program, and it's getting pretty good. We're shut down right now. That the whole area over there nearby the border, it's completely under the military's restrictions. So that one is shut until things get better. All right. And but also, like we say, we've been talking about El Talento. That's when I actually met you guys at MedGlobal, and we wanted to hit El Talento quite a long time ago, maybe a year or so. But it's such a large area, like you all saw, and you need to have the power system in order to actually make a good impact in there. And so, and by this, I want to really congratulate you all. I mean, when we made that alliance between the Pastor John's Church, MedGlobal, and Dr. Luke Foundation, and we kept going, even though many other organizations, whatever they were at, they were shutting and closing down. We kept going, and the community was like, we can go there. We're gonna be attended, and because this is a forgotten area. I mean, there's 1,200 families there, which is easily 5,000+ people living in that area. No schools, no water, and definitely no medical attention. So after 10 years of that barrier being established, this was the first time something like this has taken place. So congratulations, you guys did a marvelous job, and I think we do have a lot of follow-up, in which we will do it with our medical team, Venezuelan team, and that in fact we've done it already with quite a few cases after we left everything after we finished because of the certain specific patients that need to follow up. So we've been working on it anyway. But El Talento, it's a very interesting barrio. I mean, we have people who have fled from guerrillas persecution and from other areas of Colombia. Then we have all Venezuelans who have come out of Venezuela looking for, maybe they don't even know what they're looking for. They're just fleeing from Venezuela, and they ended up in El Talento. So there's a lot of questions and not many answers. So, and I think we're hitting the target right on as we focus on opening a clinic over there. So I think this is going to be really, really effective in long terms. Okay. We also have a program when we talking about crossing the border in conjunction. Well, this is how can I put this? All right. The director of the main hospital in San Antonio del Táchira, which is just after you cross the bridge that divides Colombia and Venezuela. After you cross the bridge and you're in San Antonio, Venezuela, the director of the main hospital, he's my boss, and in conjunction with the main hospital over there, we oversee 7,500 school children. I mean, I'm talking about teenagers and elementary school children. All right, and even though officially we cannot work as Dr. Luke Foundation over there, that would not be a good idea. But we are able to somehow see the health of all these many children all year long. This is a school year program, and it's under the supervision of the hospital, and then we come under them, and that's how it works. So it's really good. I mean, there's only four of us working on it. I mean, 4 medical doctors there, and so it takes a whole year. Like right now, it's stopped. I mean, all schools are shut, so we'll have to wait to open again in the near future. But that program is actually really good because it touches a lot of children as well as parents. Parents will come, they receive orientation, and there's always someone else outside of the school needing medical attention. So that's really good. Okay, we've done a lot of. We've taken a lot of medicines across the border because of that program. And sometimes it works, sometimes it doesn't. Most of the times it works. I mean, like you're able to take stuff over there. So that's good, okay? We also have the possibility of running brigadas in Venezuela, the near towns as soon as you cross the bridge. What we set as a plan as soon as the bridge opens again is that we're gonna run 13 brigadas, and each one is gonna be aiming towards 300 patients on every place we go to. It's going to be once a week on different barrios for 3 months. All right, and but the first one we would like to run, and then on that keep it constant, is that there is the possibility of taking a risky step. Is this. The hospital would like for Dr. Luke Foundation to run a clinic, a brigada, for the National Guards over there. I mean, the headquarters. We're talking about 300 soldiers plus their families. I mean, they're humans. I know you've heard a lot of stories, and I have heard them. I have actually seen them, but they're humans, and they're running through a lot of sicknesses anyway. So there is the possibility of, through the hospital, going and taking brigadas at the headquarters. And of course, there is a risk on it, but it'll be a great open door. In fact, if we could do that at least one time, which it'll be better if once a month, if we could do that at least one time, we will be able to stop smuggling medicines into Venezuela, because they'll open the doors for us, and we would just cross the bridge with the entire, supplies there, and there will be no problems. So it's something I do like the idea, and I hope as soon as the bridge opens, we come back, we make this, to actually come to a fulfillment. So, and I hope, we can join on this. We don't use names over there, right? I understand that, but it'll be like the hospital, assistant, the National Guards, and that's it, okay? But it's still a great idea. And if you have any questions, I'm speaking, while I'm speaking, or any comments, just let me know. I'll stop and I'll listen to you, okay? So we're talking about Talento, school programs, and the clinic over there across the border. And before we talk about our doctors who actually came in and were on the Brigada en el Talento, the medical doctors, and the whole issue of how they cross the border through what we call trochas, which is crossing through the river, and then how difficult it was for them to return and all of it. I'd like to show a video if it is available over there. Lindsay, would you please?
Yep, I'll do it on my computer right now.
Thanks, God. No, está tratando de poner un video. Ya empezó. There's no audio.
Oops. There's no audio.
No.
And I just see the breakers right on the back over there. Who's getting this money? The gorillas. Gorillas this is a gorillas business.
So if anyone in the North American media says there's not a crisis in Venezuela, what do you say?
They have no idea. You really have no clue. I mean, you got to.
Okay.
Argenis, let me add something, please, for the group to understand. You said it in passing. As the COVID crisis was progressing and volunteers were withdrawing from our side, appropriately, not inappropriate at all, I'll tell the group that 3 of our 4 Venezuelans, 2 came from Caracas, which was 10 hours away, and the bridges were closed, so they were forced to cross the trochas, cross the water, cross the rivers by foot, and then hike 5 or 6 kilometers to get to safety in order to work with us. These are true heroes and need to be thanked at every turn. So Thank you so much, Argenis. We will certainly work at securing Brigada work both on the Colombia side of the border and on the Venezuelan side of the border.
Yes.
As we move forward, though, I'd like to ask a colleague of ours, Denise Pareja, to speak if she could, please. She was instrumental in the beginning of this of our program and has been instrumental since then. So. Denise, if you're still on and could say a word, please.
Hello, everyone. Yes, of course. So my name is Denise Pareja. I started this program along with Dr. John Kahler and Sahir Sadul. We before establishing in Cucuta, we visited several cities in Colombia alongside with the Ministry of Health. And unfortunately, the needs on those cities were high during that time a year ago, and they remain high, unfortunately. We decided to establish ourselves in Cucuta, as Lindsay mentioned, seeing the epicenter of migration and seeing that even though there were organizations providing healthcare, there were a lot of gaps within those services. So I'm very proud to say that MedGlobal is a well-established clinic right now. We are one of the few organizations that provides comprehensive prenatal care for Venezuelan women, including all prenatal care services, psychology services, nutritional services. And it's very rewarding for us to be able to serve these patients because we are the only healthcare facilities that they have access to, and it is very again rewarding to be able to serve these patients because some of the conditions that they have can be treated and can be prevented. And by having the services that we are providing alongside with our staff and our volunteers, we are able to do so. So we of course plan to continue to be in Colombia. We established our clinic in Cúcuta. We have a new clinic at the border, and also we started our brigades with El Talento. It is very important, as Argenis mentioned, that the cross borders activities that we are trying to do, of course, are one of our priorities on the ground, and we are planning on expanding that in the future. Colombia itself has been great in doing their best on providing healthcare to these to the Venezuelan migrants and refugees, and has certainly helped us as well to provide our services. The needs on the ground, to understand it even more, are a reflection of the healthcare system in Venezuela. We have a great need on prenatal care. Cases that were not seen anymore, such as congenital syphilis, are being seen right now. And also chronic diseases such as hypertension or diabetes are in great need due to the lack of medications. And another area that is very in need is malnutrition in children. We have the availability to work with a partner in our clinic to provide nutritional services for children with malnutrition. So those are very key topics of real needs that are seen on the ground, and that most of them can be prevented. And if we can provide nutritional to these kids, if we can provide an appropriate health care, prenatal care, we can prevent many other more serious conditions. So please, if you want to know more about this program, I'm great that you are listening to this topic. Visit our website and please support us so we can continue to provide these services. Thank you.
Lindsay,
Hello?
did you
Thank
want
you
to
so much, Denise.
introduce Ellen?
Now I'd like to ask, yes, I'll introduce Ellen. I'd like Ellen Dowling to speak as a medical student that has been working with us in Colombia for a couple of months before she needed to leave. Ellen, prior to working in Colombia, she had also had experience working in Bolivia and Chile. She was working closely with Dr. Houck to put together some research projects on childhood malnutrition and prenatal risk factors. So Ellen, if you'd like to say a few words about your experience working at our clinic and also at the brigade, that'd be wonderful.
Hi, yeah, thanks so much for having me, and thanks so much for the opportunity to work with you guys. I know it was pretty unconventional to have a med student on the team, and I'm very grateful for the opportunity to learn from the good work that MedGlobal has been doing. So yeah, we wanted to kind of get like a mini pilot project going with regards to nutrition status in children and pregnant women, just because we're seeing a lot of that, and then trying to see if there's anything that we were missing as well as far as like prenatal screening, just because of the alarming high rate of syphilis that had been coming out of some of the public hospitals there when with birth complications. And so we just primarily what I would do in the mornings is get to clinic early and then try to do basic biometric scanning on a bunch of the kids and prenatal women, and then would end up shadowing some of our wonderful volunteer doctors the rest of the day. And then for the brigada, on our intake sheets, we got mid upper arm circumference as well as height, weight, and stuff to get BMI info, as well as other kind of demographic stuff for a lot of those patients, especially for children under 16 and then pregnant women. Even though the WHO usually a lot of their biometric stuff is just for kids who are under 5, we were seeing a lot of malnutrition in kids older than that, even though it's unfortunate that like our Action Against Hunger, one of our partners, they do a really great job with prenatal and childhood malnutrition for kids under 5. But we noticed that a problem was for kids 5 and older, in like say 11-year-old comes in and they have severe malnutrition, they don't have like a protocol in place for them. And so with this data, what we hope to do is try to mitigate some of those issues and try to provide more resources in this really trying time for them. One thing that I do want to say about related to COVID is that during the brigada, it was overwhelming how incredible the teamwork was from our community partners and community volunteers. Part of what I would do is help get registration going with a lot of the community volunteers and training them, and they were so willing to be adaptable and to try to get this new triage protocol in that was kind of new on what their compared to what we had been teaching them about, like taking height, weight, temperature, things like that. But then when it came to the point of COVID, saying, all right, we need to take temperature, and then anybody that also has a cough, put them in an isolation area. They're the ones that get face masks, because we had, of course, limited PPE. Like the whole world is out of PPE right now. So teaching our volunteers, and they were really willing to work with us. And I'm just really impressed with their support and their adaptability to make sure that our brigada could still be realized during this time, as well as in COVID. I think that there was maybe 1 or 2 suspected cases that we had seen, even though every kid has a cough, but not everybody necessarily has a fever. So but especially I think that was like right before it really got big in cuckoo test. So, but just having that in place and just being really impressed with the community efforts there to help us during this, unprecedented time. So yeah, I really appreciate learning from them and from you guys. So thanks so much.
Thanks so much, Ellen, and we really appreciate your work with us over the last few months. Hopefully we can continue to work together remotely in these new times. So I think at this point we'd like to open it up to questions. I don't know if if be on the technical side if you want to unmute individuals' questions or comments that they'd like to make. You can feel free to chat your questions in the Q&A chat box or directly to us. Panel. Okay, great. So as we're waiting for questions to come in, I think we'd like to open it up to a larger conversation about what more MedGlobal can do to prepare for COVID in Cucuta, in the border state. I know that when we were in Cucuta a couple weeks ago, we had a meeting with the Secretary of Health in Cucuta, and there was, we asked a lot of questions about, what kind of collaboration have you been able to achieve with the Venezuelan government? And I know that there's, not a lot of trust. There's a lot of speculation about, numbers that are coming from Venezuela. So given that Colombia is kind of in a moment right now where it feels like it really needs to protect its borders and is really primarily in charge of any response efforts, what more do you think MedGlobal can do as an NGO to help prepare for the new cases of COVID that we'll certainly be seeing over the next couple of weeks?
Maybe I can respond to that. We had collaboration with the Health Secretariat in Cucuta. We had collaboration with the Ministry of Health. I suspect they're probably swamped right now. What we can actually do on the ground, of course, is extraordinarily limited because we can't get there. I think maybe the best thing we could do is provide consultation, provide any help we could give online to anybody who wants it. And for example, this afternoon I'm giving 2 lectures to medical students at the medical school in Pasto in southwest Colombia. Other people have asked for some help. I know Denise called me last night with a very intriguing thought about working in her home city in Ecuador to help with the response there. So I think there are some things we can do. Denise, I don't know if you want to say a couple words about that, but I think we have some opportunities still to do some things virtually, though what we can do in person is pretty limited.
This is John. The good news, obviously, is that this is not the third world, as they have a well-established health system. It'll get overwhelmed just as ours has. And I think that certainly screening of our refugees and migrants is important for us to do. And as much financial support as we can give the tertiary care hospital that is setting up their COVID response, I think that's very important for us to think.
Great. So we have a question here for our panelists. Let's see. So firstly, are you finding TB prevention protocols helpful in the mitigation of COVID and potentially using mechanisms for community health and education that have been successful in reducing the spread of TB to reduce the spread of COVID? I don't know if we've seen that or if we're implementing that in our clinic, but any more information about how TB prevention protocols can be helpful.
To be honest, I haven't seen that much tuberculosis. I know there's a lot in the clinic. I've worked in the Cucuta clinic perhaps, I don't know, 6 visits or so, 6 or 7 visits. I've seen a few cases. I know that it's a big concern of public health there. I think that's one of those areas where we probably need to do some development work. In the context of COVID, again, I think what we can do right now is pretty limited just because of the practical problems of getting there and working with people. We're going to be working with our partners at MedCare who actually are running the clinic right now. And that's certainly somebody you can come up with. But I think right now everybody's overwhelmed with the basic issue of COVID.
Yeah, and I think the basic, the Colombia government's approach of locking the country down for this moment is probably as good as approaches can be. And they're out ahead of the curve. I think as of yesterday, the first cases came in the 5th or 6th of March, I think, or maybe even a little bit later. And I think yesterday they were up to 914 confirmed cases, of which the vast majority the majority are in Bogota now.
Yeah, I'll mention one more thing. I first started working in the field of sort of pandemic planning in Colombia in 2011 at the airport in Bogota. And I've been really impressed with what they've done. They've been aggressive, they've been timely. I think they've been pretty smart. I know there have been some political issues, as there have been everywhere in the world, but I think the public health in Colombia, as I've observed it essentially always to be, has been pretty impressive. As John said, this is not a developing country. It's has a very advanced medical system with flaws, definitely, but it's not a developing country medical system. I think they're doing a very good job.
So here's another really important question for many refugees and migrants living in settlements without access to clean water. I know we saw that a lot in El Talento. It's one of the biggest issues there is there's not clean water throughout the month. And so, a lot of the prevention measures are regarding personal hygiene. So for migrants and refugees living in, substandard living conditions, what do we think we can do as an organization to kind of respond to that? Have there been any innovative ways in which we could mitigate the impacts of COVID for these low resource communities? I know that during the brigade, we were doing health education seminars. There were lots of questions about COVID and how to prepare for that. But the reality is, for many people, if the prevention measure is social isolation, many of the people that we were working with have to go to work each day to get the money that they need to survive. And so, social isolation and staying at home is, not an option for a lot of people. So I think we were really seeing the reality of that with the patients that we saw during the brigade.
Argenis, could you address that question, please?
Well, I know we started first about the use of clean water, and then we spoke about, Lindsay said about the COVID situation. Yes, here in Colombia, when it comes to being in quarantine and people in El Talento and other areas, the country doesn't have as much resources as other nations in order to provide for the people so they can stay home. So people are going to have to go out and keep working. This is what you see here in Cucuta every day. You have to go out and produce, right? Now, about the use of clean water and refugees, right at the border, there are 3 places that they provide clean water for anybody who wants to, who needs to. And so that has been a very effective program right there as soon as they cross the bridge. So because we have a lot of homeless around that area, they use a lot of that water, and that has helped a lot in terms of all the sicknesses that used to come with drinking not safe water. And so, yeah, well, that I can tell you now. When it comes to El Talento, you guys know they only receive water every 25 days. And so then they have to wait for another month. And so in that situation, it's hard to change it for a simple reason. There's no way to get water to that area without a major investment from the government side.
One of the program that Argenis mentioned on the Colombia side of the Simon Bolivar Bridge in Rosario is actually one of the areas that's now slammed closed. There's no more access to that in addition to food. So the two of the programs that were helping public health wise vis-a-vis the refugees are now closed because of the COVID crisis.
Great. So there's a couple of questions here about testing. Does MedGlobal administer COVID tests? So right now, testing is any suspected cases are sent to the public hospital in Cucuta. There are 3 locations right now where people are able to get the sample collected, and then that test is still being sent to Bogota at this time. There was an issue recently in Bogota with some test machinery that was not functioning properly, and so they're addressing that. But there is a significant lag in time between the time that the sample is sent to Bogota and results are received. So they're scaling up capacity for collecting samples and getting those test results back sooner. But right now it's still a bit of a delay.
I'd like to take the comment on it. It's the truth is, like you're saying, Lindsay, the system is not in good shape. I mean, it takes way too long, and it's already collapsed at the main hospital here in Cucuta, actually. And that's, I know we're talking about whether MedGlobal has access to it or not, but generally in the city, that's how it is. So a lot of people are not going to be running tests, okay? Now, the surprise was the fact to see Venezuela having the fast test result. And so they are testing people as soon as they cross the bridge, and it takes them, I don't know, I think it's about an hour or so, or 2 hours to get the result. And our medical team who was able to cross finally, they stopped there, they were checked on it, and they tested negative for COVID-19. So good. So yeah, Colombia got by surprise this virus, and the system is not ready for them to go as fast with the criteria of test early, test frequently, isolation. So very much it's about isolation for people, whether they have it or not.
Great. Another question here is about the UNHCR and the cluster system in Colombia and their ability to respond to this crisis. The question asked specifically, are any data collection systems used? I can answer that and just say that the health cluster is currently working to coordinate the response. They work very closely with the Department of Health. So that coordination is co-led by the Department of Health and the cluster system. And so the response at this point has been very much focused on food and hygiene kits. So over the weekend, there was a joint effort by the Department of Health, the military was there, some international organizations were distributing food and hygiene kits around the area of the International Bridge. As far as I know, the UNHCR cluster system is not collecting their own patient level data, but that's being fed to us from the Department of Health. And they've done, a really great job of bringing that information together and making sure that, we're in direct communication with the Department of Health and, activities are not being duplicated and everyone is working together to address the most pressing needs. I can also say that MedGlobal, I think this was mentioned earlier, MedGlobal is working on a donation of 3 ventilators to the public hospital in Cucuta. Right now, they have a total of 6 ventilators, and they're in the process of setting up a triage unit outside the hospital for COVID patients. And so those ventilators will be used in that new setting. So this is a couple of questions about the trochas that Argenis had talked about. How are the police treating migrants who use the trochas? And you know, is this are they intercepting migrants at that place, or are they letting people pass through? I know there are a lot of people with, you know, chronic health conditions that still need to access treatment in Colombia, and I know that we're looking at ways to provide exceptions to that and letting people come through as needed.
One of the reasons I wanted everyone to watch that video is because that's exactly what's taking place right now. I know the video wasn't in good quality or whatever it happened, the audio, but hundreds of people are trying to cross through the trochas or the river, all right? In many cases, it's about money, whether it's a chronic condition or not. And I know it doesn't sound good, but that's how it is, okay? They have to pay in Venezuela to guerrillas, and then they have to deal with whoever is in charge on this side of the country, okay? And it doesn't sound good, but that's reality. And so if you got a few pesos, you might be able to cross. If you don't, well, you have to go back. And so at certain points, at certain times, they actually opened the bridge. They started it yesterday. And hundreds of people were lining up. I mean, the doctors sent me a picture, and there were around 3,000 people waiting online to cross the bridge. And so, but when you see that many people on the bridge, it means it's probably the same or more to cross the trocha. So it is a big business, and the need of someone, you know, whether it's sick or not, might help, but it's just a business, and that's a reality.
And it is going to get worse the longer this goes along. I mean, the more the bridges are closed, the more the queue increases, the more the gangs will take responsibility for helping people across the trochas. So the longer the bridges are closed, the worse the condition is going to be, not the better.
Great. So we only have a few minutes left. I'd like to turn it back to our panel and ask you to make any final remarks, any reflections you have on the current situation in Colombia, Venezuela. I think Argenis has to step out. So if you'd want to give us your closing remarks first, and then we'll have Dr. Kahler and Dr. Houck speak as well.
Well, actually, I think a very key thing is strategic alliance, and I think that's what we're doing right now. And let us continue. Let us keep on it. And in spite of the restrictions that we all know, let's keep pressing on, because people need them. People have a need, and we might have part of that answer, but that's some, and that's great. So let's just join together, and we keep on going, okay? Hey, congratulations.
Thank you.
Peter, I know you have to leave. You wanna say anything before you go?
Sure. The work that's being done in Colombia is extremely important. But one thing I do want to mention is the work in El Talento, I think, offers to me anyway, one of the most exciting opportunities to do true community development that perhaps MedGlobal has had, and probably one of the more significant ones I've ever been involved with. We have a chance to help a community that currently has no healthcare services at all, and help develop a community-driven, community-directed, and perhaps a community-operated healthcare system that will survive long after MedGlobal has left. I'm extraordinarily excited about the possibility there. the whole COVID situation is obviously a major issue right now that puts that sort of healthcare system development on the back burner. At least it makes it very, very difficult. But I think we have a fantastic opportunity here that is going to pay some real dividends for that community, for those 5,000 or 6,000 Venezuelans and Colombians who live in El Talento for many, many years to come. So to all those of you who have worked to develop this program and to develop this opportunity, I say thank you and congratulations and keep up the good work. So I'm going to sign off right now and go finish my slides, and I'll talk to you later on. Hasta luego.
Thanks, Peter. Let me speak to the crisis at the border. Things in Venezuela are getting powers of 10 worse. MedGlobal has always been in a situation where we prepare for the day after. This is one of the things that we're doing with the Luke Foundation. Hopefully we'll be able to cross, actually, even if it's just in to help with these brigadas that were mentioned. This is a dire situation. It's been kicked off the front page, obviously, by everything from Syria to Greece to now COVID. It's kicked off the front page does not mean it's going away. Let alone is it not going away, it's getting worse. And with the help of our supporters at the LDS Church, we'll continue our mission in Cucuta, and we'll prepare ourselves for the day after. So let me thank everybody who participated today. Thank you so much.
Thank you, Dr. Kahler. Kat, did you want to give us an overview of the rest of this webinar series so participants can know what to look forward to?
Yeah, thank you, Lindsay. I mean, first, just thank you all for joining, and thank you for our amazing panelists. That was so informative. I'm really glad I got to hear more about the Brigada and the work that you're doing. So upcoming over the next few weeks, we'll be having Thursdays, again, the continuation of this series on the global health response for refugees and IDPs in the time of COVID-19. We'll continue next week with Syria, and then we'll be continuing with Gaza, Bangladesh, Yemen, Lebanon, and Pakistan. And so look out on our social media for more information about that. And then before we close, one thing that we would really love you to consider is supporting our really urgent COVID-19 response right now. I've just put a link to a crowdfunding campaign that we've started in the chat. And in particular, as you've heard from our panelists today, and I'm sure as you're all aware, there's a global shortage of PPEs all over the world, but especially in conflict-affected countries. So we're immediately responding in Gaza, Syria, Yemen, Bangladesh, and Pakistan with PPE, including masks, gowns, gloves, and eye shields. And our goal is to sponsor 2,500 health workers. So if you're able to give even a little, please consider giving to our crowdfunder here.
Great, thanks so much, Kat. With that, I'd like to wrap up this first webinar in this series. Thank you all for attending, for participating, for your thoughtful questions. We really appreciate you following this crisis. We intend to keep you updated through our various social media channels on what's going on in Colombia. And we very much appreciate your support. Any last words, Dr. Kahler? Are we good to go?
No, I think we're good to go. Thank you, everybody. Really appreciate it.
Thank you all.